Developing right now, flu-related cases are spiking after the holiday rush here in California and across the entire country, reaching the highest levels in 25 years. And there's a new strain believed responsible for this spread. This news comes as the Trump administration announced today that it plans to recommend fewer vaccines for most American children. Our Tara Lynn Wagner joins us now live in Glendale with new developments. Good evening, Tara Lynn.
Good evening, Giselle. Some people are calling this the super flu because of the extreme nature of the symptoms, and they last for weeks. Now, right now across the country, almost every state is experiencing what is considered high or very high flu activity, including California.
However, it was the most horrible experience.
Mary Anderson is generally careful about germs.
I go like this.
But somehow she still got the flu this season.
I just got over, I believe it's the super flu. And the reason why I say that is because it lasted 3 weeks.
This is a particularly bad year. According to the CDC, there have been 11 million cases across the country so far, the highest level seen in 25 years. Hospitalization rates for influenza jumped more than 30% in the last week of December, with 5,000 deaths attributed to the flu so far this season, including at least 9 children. Dr. Douglas Weber keeps his office stocked with flu shots, but this year, he says, has been tricky because the main strain called subclade K is new.
The vaccine typically is manufactured from the predominant strain from the previous flu season. However, there is still a benefit, we believe, in getting the vaccine.
Dr. Sharon Balter with LA County Department of Public Health agrees, both as a doctor and as a parent. Her daughter, who was vaccinated, got a severe case of flu last year.
She told me it was way worse than COVID, and all I could think was, I'm so glad she's vaccinated. She probably would have ended up in the hospital.
As for flu vaccine rates across the county, she says the number is up a bit among adults, but down a bit for kids. And that could well be connected to messaging out of the nation's capital. On Monday, the U.S. Department of Health and Human Services dropped the number of early childhood vaccines it recommends and said it should be up to families and their doctors to decide on other immunizations, such as flu shots.
I think that, people have become more ill at ease about vaccines, and that's really unfortunate. The vaccines have done a tremendous job of saving lives.
She highly recommends everyone who's eligible get the flu shot this season, stressing that it's not too late. Dr. Weber says that's true even if you're not in a high-risk group.
It may be true that you are not likely to get severely ill from the flu if you're infected, but you then may infect unknowingly someone else who is susceptible.
Mary doesn't know how she got the flu, but remembers hearing a lot of coughing while she was holiday shopping. Now that she's finally on the mend, she's taking precautions to avoid getting sick again.
It's almost like impossible to avoid. You have to really be on your JOB right now.
Officials say that means washing hands, covering faces, and making it a priority to get that vaccine. And Giselle, while some people feel like they may just ride out the flu if they get it, officials stress that there are medications available. You just have to start those medications within 48 hours of symptoms. So if you are experiencing any flu-like symptoms, you should really call your doctor immediately to try to get on Tamiflu or one of those medications.
Boy, that's for sure. For anybody that had it, they know. How is LA County responding to these new recommendations?
Right. Well, like the state of California, LA County has released a statement saying that there will be no changes to the vaccine schedule here in LA County or to vaccine availability. They say that the current schedule is based really on decades of scientific research and that they are safe and effective, and they won't be making any changes at this time because the changes are based on, they said there's no new evidence that the vaccines are unsafe or ineffective. So again, they're stressing that they will continue, as will California, to recommend, as they have been, the current vaccine schedule. And you can find out more about that at ph.lacounty.gov/vaccine.